So tell me about the two doctors you saw today, and what did they tell you?
So my regular primary doctor, he came in, asked how I was doing. I said fine. We went over what happened overnight. So I got some better sleep last night with the medication and the fact that I was able to take a shower and sleep all refreshed. And then when he was here, the oncologist came by and just said that my option still be, once I get the results, to go to Sloan Kettering for a second opinion. But they didn't have much else to say other than to see how I was doing. The pain management doctor came by, and we spoke about the many options. Pretty much everything is open for pain management, and he's going to make many things available to me. And I asked him, I want to go more natural or less less narcotics. And he says, yes, it's all open, so we're going to talk some more at another time.
So tell me about...
And later, since what was killing me all day was that I actually had breakfast. The breakfast was sitting there, but I had it like maybe 8:30, and then I waited a while before I took the medication, so I wouldn't be nauseous because the food was still up here. And if I take the medication, since my stomach is pushed up and everything's pushed up, I feel the food still there. But I finally had some medication while someone was here, and it kicked in nicely. That was the last time I had some at 10:30, because later around 4:35, I was drained again, 3.5 liters, and that's when the relief came. In fact, since then I haven't, since 10:30 I haven't taken any pain medication. I still have the patch, but that's managing for now. As soon as I take the pressure off, I feel a lot better.
So explain the draining. What's happening to you in your abdomen?
There's a buildup of fluid, which
Where? Point
is
to where?
typical everywhere. It's just the entire abdomen. It just gets in between whatever organs, and it just sits there.
And what kind of pain and discomfort is that causing you?
Well, since it's causing pressure on all those organs, aside from pain, it also somehow pushes back on my spine. Something pushes back on my spine, and then I get pains in the shoulders, wherever this kind of a pinched nerve somewhere. It radiates to that part of the body, which has nothing to do with the actual lying cause of the discomfort. So when I went for the draining, and they drained 3.5 liters, as they were doing it, I could feel all the other pains going away. And as soon as I came back, I actually was able to eat, because all of a sudden my stomach was bent down where it belongs. So.
Been here since Friday. It is now Monday night. It is 8:45, and since Friday you've been waiting for the results of your biopsy. So
Yes.
What's going on with that? And tell me how you feel.
Well, the Friday was the day before a holiday, which most people are either on vacation or taking off early. Then Saturday was the holiday. Then Sunday was Sunday, and then Monday is when they try to catch up with all the biopsies, I guess, that were accumulated over the weekend. So as of right now, I still don't have any results. Tomorrow for sure, they say. I don't know.
So even somebody who has an advanced cancer like you,
Oh,
or
well, that's
possibly-
a confirmation.
possibly have,
Yeah.
there's no lab in the entire tri-state area that can tell you what you have.
They don't send to the tri-state area. They send to the one they use here. It's not so urgent that they need it. It's not like I brought Ebola and they're going to find any lab that's open. It's the one they use here, and they have their way of going about it.
Take a number.
Yeah. And it also has to be picked up by the insurance and all those things. So, they take their time. But if you snap at them and start being nasty, you're going to get the same thing back. I know how this works here. And that's the way things go. Plus, you know, I have to be kept because as long as I'm kept here, they're still billing. There was something else too why I could have said, okay, I'm going home. I could have said that 3 days ago and just go home. But the way the pain is being managed here and the bed, I don't have this kind of bed at home, which it makes a lot of difference. If I went to go home, my regular bed, it would be painful. So this, well, from what I hear is when you go in hospice, they make available a bed like this that they could bring into your home as soon as possible. So that's the way I'm gonna go with that.
What kind of pain medication are you taking?
I don't remember the name of the Lotto or something like that.
But you are being given a steady dose of.
Not a steady dose if I actually ask. Less than 3 hours apart. I mean, more than 3 hours apart. If I actually feel it, if I don't feel it, they don't have to. So if I start feeling the pain and discomfort, they come and give it. If not, I could skip it. Like I said, I've been skipping it since 10:30. And since I was drained, then that worked.
And have they told you is there any way to stop that water accumulation?
Now, the fluids are typical of that kind of cancer. If it was something else, they could say, okay, we could go in there and stop it. But all there is draining. All there is just draining. You have to drain it. And rather than come every couple of days and have it drained a few liters, what they're going to have is, you know, the drain tube, I guess, attached when I leave here. So I could drain it myself at home into a bag, or, you know, and that would be a lot of relief. At that point, I have to, I guess, use less pain medication because what causes a lot of pain and discomfort is that accumulation of fluid. I'm sure that, you know, the cancer itself causes pain, but, you know, it's hard to pinpoint. The pain is everywhere, so.
So who did you see today in your family?
Well, aside from my wife that came and all her co-workers that I've known for 30 years, the people from my fire department, the Army, and that's one of the things why I'm probably, you know, I think I'm taking it lightly, but the great thing that I have is I had great support, and it's there. So, you know, people are there for me, and they come right away, and as soon as they find out, they, you know, they leave their baby to want to come here. So, in fact, one fellow firefighter has a new baby about 3-4 days old, and he said, I'm going. I said, you know, don't, because, you know, your wife needs you over there. But that's actually a big part of being able to cope with this, is the support, having support.
And how is this whole waiting thing? How are you feeling about this days after day of waiting?
It's not the days after day of waiting, because once I find out, either we confirm that I'm dead or that I have another option. But I'm also more comfortable. I mean, I would like to go home, but I'm more comfortable in this bed. For what I have, the bed makes a difference. They go, well, you're here, you're bored. I actually haven't had a chance to be bored. There's people coming in and out to see me all day, and sometimes I watch TV, and sometimes I just doze off, and, you know, lay back whenever I feel, you know, the medication or something like that, and so the day goes by fast.
What were you just feeling right there? Was it gas or was it something else?
Yeah, actually, that's just gas coming up, but it's not just a burp when it comes up. It's, you know, it affects everything else. The whole diaphragm, which feels sore. Everything just, it actually almost hits my heart when it comes up. And that was, yeah, it was just gas, but this is just moving, and then the muscles or some organ here hurts.
And you actually ate today, right?
Yes. Well, I ate breakfast, which, like I said, was up to here for 3-4 hours. And I knew it was digesting, but it was slow because it was up here. That's not the place where you digest. And then as soon as I was drained, I knew all the food was gone. I came back and I ate. Normally, no big deal. I ate everything, which was actually chicken nuggets and fries and something else. And as I was finishing that, which was lunch, which I had left there, dinner was coming in. I didn't touch it, but actually 45 minutes later, I made some room for a little piece of fish that they brought, which was very good. I was able to go to the bathroom and urinate, maybe easily 4 to 450 milliliters, which hadn't gone in at least 24 hours. And I maybe will have a bowel movement at some point, maybe today, tonight.
So it's definitely affecting your ability to go to the bathroom?
Yeah. Not because I can't so much as I feel something is being pressed and it's being actually compressed and blocked. Not internally, like in the bladder or the intestines, it's just being compressed and it can't just, it's the fluids. The fluids create so much pressure that the wall and the muscles around the abdomen are under a lot of stress. I mean, if I were to poke them, I was even afraid to poke them with a needle. I would just open up. Yeah, it feels that bad. It's very sensitive and everything, but yeah, that causes a lot of discomfort and it impedes everything else. A lot of, if you've been seeing, there's a lot of support from my fire department, from the army, from my friends, family, old friends, old co-workers. Yeah. I don't know if people are just always being nice to someone because they're dying, but I think it's genuine when they come and see me.
So at this point, what are you hoping to hear tomorrow?
I'm hoping to hear is not the cancer, that it's lymphoma or something like that, but the way that it's manifesting so far. It appears to be what they think it is. And the way they're talking about it, it's sort of terminal. They're saying, oh yeah, treatment, you could get treatment. Or treatment what? Being tortured with chemo for a couple of months? That's not, but if it's something other than the terminal cancer, yeah, and then there is more opportunity to fight it more.
So whatever it is, they're already telling you it's not something they can handle here.
No, definitely not here.
They're referring you to Memorial Sloan Kettering.
Yes. Well, they're a second opinion. They might just say, well, yeah, you're done. It's up to you to try to do some chemo, which I'm not doing chemo or radiation. I wouldn't doubt it that it is radiation that caused all this to begin with, but although that's a whole different thing. It's localized when they do it, but still. Yeah, you know, they may just confirm it. And the option again is always chemo or radiation, but I'm not doing that. I'm going some other way. That makes it even more comfortable is the treatment. The staff has been amazing. When I was going in to the room where they drain, you know, it's an X-ray room because they have to, you know, find with the sonogram where they're going to put the needle because they don't want to puncture your intestines or something like that. Where there's pockets. With the biggest pocket of fluid, that's where you put the needle in. And then everything else drains through there. So when I went in there, the nurse that took care of me, Adele, amazing. She was amazing. The treatment, what I like is, you know, these people are, at least the ones that I dealt with, and not cold and detached. We talk about personal stuff, you know, their personal life, mine. So immediately you feel comfortable because immediately you're friends with them. That's very comforting. When I was leaving, She says, well, she liked the fact that, I keep making the jokes and all that. But she says, oh, you're taking this much differently than everybody else. Yes, but then when I was leaving, she says, there's one thing I need from you. It's a hug. And that was, again, very comforting. Because, you need that kind of thing when you're doing this. You go to a place with, oh, sir, do this, move here, or move there. Right away it makes you uncomfortable. So far, I haven't seen any staff that I didn't like, except for, no, everybody's been nice. They come in, they introduce themselves, and once you get to talking to them, they becomes very familiar, very at ease. I don't know if that's just typical of this particular ward, because again, I've never been in a hospital. I've been there with other people, but I never stayed. But I've been to other hospitals, actually, for other people staying, and yes, the treatment is not the same. There's that cold, detached, where professionals think, and this is not the place for that. You don't have to reveal your entire family history or talk about your family or any of that, but put the patient at ease, and they do that very much here.